Hello to all. I'm grateful for Kathy Wang's invitation to introduce you to a topic I find fascinating. I hope to pique your interest in this brief presentation to explore how this can have immense practical value to you. Unfortunately, because of a previous engagement, I'm forced to deliver this via video, but please contact me if you have questions. Recently, I asked if oculofacial surgery was complex or merely complicated. I explored the topic in depth with concrete examples. Today, though, let's ask the further question, should you care? Well, do you see patients and recommend treatments? Do you prescribe medication? Do you work with other people in multiple settings? Do you wonder about the scope of practice? Do you want to thrive or merely survive? If you answered in the affirmative to any of these, then you do need to understand complexity science, nonlinear dynamics, and complex adaptive systems. But this won't be easy for many of you. I know it wasn't easy for me. We are accustomed to using the scientific method of reductionism. When faced with a problem that isn't immediately recognizable, we usually break it into smaller pieces. But is this always optimal? I'm going to challenge some of your beliefs in this brief introduction to this topic. You may need to change your opinion on some things. I hope you will bear with me. These two individuals are very much responsible for our method of thinking. Sylvanus Thayer was the first superintendent of West Point, and Frederick Taylor was the father of scientific management. They introduced an orderly, linear way of thinking and were proponents of the reductionist mindset. While that is often very helpful, does it always work? If we cut an elephant apart, for example, do we just get smaller elephants? Moreover, can we optimize those pieces and put them back together again and have a better elephant? Thinking we can is part of the reason healthcare has a hard time learning from failures. We don't understand how to change our thinking. Can you recall being mystified why some things that should have worked just didn't? Hopefully this brief introduction will inspire you to investigate the concepts I will cover in more depth. But at the outset, I want to again acknowledge this won't be easy, especially for smart people. We need to go outside of our comfort zone, stop doing what we are really good at, and get away from problem solving and getting an answer, and concentrate on first making sure we are asking the right questions. Reading this was an epiphany for me. I happened upon this article by chance a few months after graduating from the USC Business School. It changed my life. I sought out David Snowden and spent some time with him. I had always thought that given a problem to which I didn't initially see an answer, if I learned more or sought the help of an expert, we could together work it out ahead of time. When that didn't work, I dismissed it as just not getting enough information. I didn't try hard enough. I assumed that something that was complex was just really, really complicated. I was very wrong. I also learned why best practice is only helpful when dealing with simple problems. Yet in medicine, we are told this is the answer for everything we face. That just isn't true and will lead to frustration. Have you ever felt such frustration? Complex problems, or wicked problems if you are familiar with the term, cannot be solved ahead of time. The Cynefin framework divides problems into fluid categories depending upon their context, the relationship between the agents involved, and how cause and effect are related. With simple problems, cause and effect can be seen by everyone. This is the proper domain of best practice. However, when the problem becomes complicated, cause and effect may only be seen by subject experts. Multiple good practices can be employed. In complex problems, cause and effect are only seen in retrospect, and practice depends on the context. What works in one situation or at one institution may not work at all at another, because the starting point and supporting structures may be different. The Stacy matrix can be used to sort out the situation. When there is certainty of outcome and strong agreement on course of action, the problem is simple. As one proceeds along each axis, one can move through complicated into complex and finally into chaos, where cause and effect have no relationship. In a complex adaptive system, be it in the relationship between a physician and a patient or the function of a health network, multiple interdependent agents act under loose central control. Cause and effect are only seen in retrospect. The starting point is critical and the process moves by attractors. An order emerges from the interaction. An attempt to impose external order invariably shifts the process into chaos. In such a situation, the key is managing the unexpected. Competence is not enough. as the situations may never have been faced before. Capability is what is needed. Standardization and control of information, in other words compliance, are inadequate to really thrive in a complex adaptive system. One needs to employ mass collaboration and engagement to improve and share actual knowledge and translate that into optimal performance. So, if you see patients and recommend treatments, you must understand attractors to influence patients, not control them. You must know when to use best practices and when they actually are harmful. You can harness technology to move from the complex to the merely complicated. 1,000 years ago, crossing the North Atlantic was truly complex. Now with technology, it is only complicated or even simple. If you prescribe medication, you must understand the logic of dose-response curves and pharmacogenomics. Search the internet for the story of Tusco. Tusco was an elephant that died in 1962 because drugs are not metabolized with a linear relationship with mass. Yet we have been taught to prescribe drugs on a milligram per kilogram formula. Pharmacogenomics can explain variability in response to medication in our patients, and testing is available to check on this ahead of time. Working as a team can be hard or easy. One needs to understand the effective engagement, attractors, organizational culture, and emergent order. This is critical as the performance of the team follows a nonlinear relationship with the degree to which you understand these concepts. Unfortunately for ophthalmology, optometry already understands these concepts. We are behind and will not catch up until these lessons are learned. If we do, we will continue to innovate and meet challenges of disruptive innovation in our own field. In short, we will adapt. So, is oculofacial surgery complex or merely complicated? The answer is yes. We need to use the right tools for the job. Use the Stacy matrix to determine what is complicated and what is complex. Harness emergent order with attractors when the problem is complex. Recognize innovation is born at the edge of chaos. Above all else, I recommend you not jump into an attempt to apply complexity to healthcare without first understanding what complexity actually is. I did that, and it confused me and set me back months. First, watch these two very short videos for an introduction. Learn about attractors and emergent order. Browse the website of the Santa Fe Institute and contact me if you would like a progressive syllabus on further information. It will save you a lot of time and frustration. This can be an exciting and very, very rewarding journey. Thank you.